Hello, everybody. This is the final Tile Talk in the year 2023. I have the honor to introduce to you Dr. Orania Varsou. She's going to give a talk today on active learning pedagogies at the intersection of anatomical sciences and health humanities. Orania is a medically qualified anatomist with a PhD in neuroscience, currently working at the University of Glasgow. She teaches anatomy to science, medical, and dental students from sub-honors to honors levels, with her specialist areas including the head and neck region and imaging. Orania also teaches scientific skills, including statistics for biosciences, and delivers bespoke teaching on medical health humanities at the University of Glasgow, and as an invited external faculty member at several international institutions. Orania's research includes imaging, clinical applied anatomy, and scholarship of teaching and learning. She's also a strong advocate of medical health humanities, writing her own poetry, and is passionate about sustainability and alternative approaches to teaching in higher education. So welcome, Orania. I'm going to pass on to you. I'm going to stop sharing my screen right here, and you're welcome to share yours.
Thank you, Carolina. Thank you for the kind invite as well. So please give me a minute to share my screen, and then I'll start the talk. So first of all, as I said, thank you very much for having me, and especially for having me for the last Tile Talk for this year. So what I will discuss is the active learning pedagogies at the intersection of anatomical sciences, and something that is slightly different, how we mix anatomy with health humanities. Oops. Oops. Oh, something is not right, so bear with me. Can you see my screen okay?
It's black at the moment, so maybe you'll go to, if you go on, yeah, let's, no, that's exiting the.
It's interesting because it worked fine when we were trying during the testing before.
Can you go to the first, can you go to the first slide? Can you click on the very first slide there on the left side? Can you click on that?
Which one?
On the first slide.
On this one, yes.
And then go again. And then on the top right, on the bottom right, you go on presentation mode. The little screen.
This one? No, this one. The slideshow.
Just as you start your presentation, just start it again.
Yes.
Okay.
And then.
Yeah, let's try that.
Oh, yeah, right. Okay, that works. Okay, fine. Sorry about that. There seems to be technical difficulties always with me lately, but I'm sorry about that. I will start again. So thank you for having me. So before I start talking about the two cases that I will be discussing in this talk, I thought it is important to discuss the context of what is health humanities in the field of anatomy. So health humanities is very simple. It's basically merging the arts and humanities with anatomical sciences. And this is quite important because it allows healthcare students, but also bioscience students, and also qualified professionals with an opportunity to develop an insight into human suffering and illness by proxy, because not all of us have experienced illness. Not all of us have experienced human suffering. So looking at the human body and looking at pathologies through the lens of arts and humanities allows us to develop a better insight into this and a better appreciation as well. And this can be quite crucial, especially for any healthcare student, because of course they will become qualified healthcare professionals, and caring is central to their job, but also for bioscience students, because some of them may end up going into postgraduate degrees that involve healthcare professions, but also into research that is integrally connected with healthcare. So what am I going to discuss today? Today I will discuss two artifacts. So these are two case studies from my own teaching. And these can be adapted for both online learning or physical on-campus settings. And I will discuss this a little bit more towards the end of this talk. So my aim is to disseminate these resources and my experience, not just for myself, but also for anyone else who is interested, so they can use them for their own teaching and see how they can also incorporate them into different programs and degrees. One thing I would like to mention is that this work was part of my PGD, but also it has been submitted as a book chapter with the same title in Theodora Chellinga's book, who is the primary editor, which is a Greek anthology on health humanities. The full title is Asclepion των Ανθρωπιστικών Επιστημών, which translates to Asclepios of Health Humanities, and this will be coming out early next year. So before I discuss the actual case studies, I think it's important to discuss what is object-based learning and what specifically I have used and has influenced a lot of my teaching and research in this area is Prompt's definition of object-based learning. And what he specifically said in 1982, when he actually established and launched in a way the field of OLBL, is that any item made or modified by man is actually part of object-based learning. And that definition is quite liberal in terms of allowing teachers and researchers to adapt their learning in terms of what resource they would like to use for object-based teaching. And in my particular case, the artifacts that I will be discussing include teaching material that contains a range of physical and virtual resources. So when we're thinking about object-based learning, we're thinking about just one physical entity. Here, this is extrapolated and includes the teaching material and everything that teaching material utilized during a specific session, including the lesson plan. So I will start first of all with the first artifact, which is anatomically related visual imagery. So this was a 1-hour lecture that was linked with a 2-hour workshop. They were both delivered as part of a new course entitled Humanism in Medicine, which was introduced for the first time this past academic year at the University of Pope Fambra in Barcelona in Spain. A little bit of context about the course so that we can appreciate more this particular artifact is that this is an elective medical course. It takes 10 weeks to complete it, and it takes place in the 3rd trimester of year 2. This year, this included 40 undergraduate medical students with a 70% enrollment rate in this particular course. And the approach for this particular course is a hybrid learning style, including both physical, on-campus modes, but also online. In my particular case, I actually went to Barcelona and I delivered my teaching on site. And I will explain why I did that in a wee bit. And the teaching languages included English, Spanish, and Catalan as well. So the learners are well versed in all 3 versions. And their assessment actually is in all 3 languages as well. So the first part of this artifact was the lecture. And the lecture was quite important because the students didn't know me, and I had to introduce for the first time a topic that was somewhat alien to them. So it was this discussion of what anatomically related visual imagery entails. And these are a lot of different words that they have encountered, but separately. They know about anatomy because they have learned about the human body. They know about different types of imagery because they have learned about radiology. They have seen visualizations and the rest, but they haven't really linked the two together and how they can form a narrative for the exploration of anatomical research and teaching. And that's what was quite tricky in this particular session. what I wanted to do with the students wasn't just to pass information. I wanted them to be active participants in this particular lecture. So while I was delivering the information, I was also engaging them using Mentimeter, and we were co-creating certain visual outputs together. And the visual outputs we co-created included drawing on topics of humanistic values, including empathy, respect, compassion, but also on challenging topics when we're considering research. So what is the difference between validity and reliability? What are threshold concepts that are important for medical students? To achieve this in the lecture, because I only had 1 hour, I decided to use case studies that specifically targeted anatomical research and teaching. And the way I did that, some case studies focused on the visual element and some focused on mental imagery. So the visual imagery was actually showing them illustrations for research papers and discussing them, or from books. Whereas the mental imagery was, I was using the idea of storytelling through a specific narrative, let's say through what an author was trying to prove through their hypothesis and their aims, and how they actually achieved that through the results and the discussion. So forming that mental imagery while we were going through the written information. This is quite novel. It hasn't been done before, that art of storytelling to form mental images, and from these mental images to be able to discuss certain topics like empathy and compassion. And then the following day, after the lecture, we had a workshop, and that workshop was very much developed following the lecture. It was actively informed by the co-created Mentimeter outputs that we had from the lecture. I didn't want to just go and deliver the usual workshop that may have worked in a different program, because I didn't feel that this would represent the students that they were in the room there. And also I wanted this lecture to inform what the workshop would look like and what it will include. One thing that was that we knew from the very beginning was that the workshop was going to be delivered at the Royal Academy of Medicine of Catalonia, and specifically in the Sala Guibernau, because the Sala Guibernau was used to deliver anatomy teaching, and they have a very traditional setting with a marble dissecting table in the center, the wooden stools all around, and it's a very nice cozy amphitheater, but also it's a historical venue. And I felt that it was the most appropriate setting to combine the historical element of the workshop and what we had discussed in the actual lectures, with the modern element, which is the research part. And in the workshop, we focused predominantly on what art means in the context of anatomy, and specifically within the dissecting room. And to do that, we used illustrations from historical books and contemporary books, including research publications as well. So these were, as I said, these were influenced by the lecture very much, and I had brought different resources with me as well. And also I was using what they had available already in their library. We also used hands-on examples of engaging and promoting active learning by asking the students to develop their own brain circulation anatomy model, and linking that in what does this mean in terms of art, how is this art, and how does this actually promote learning. Something actually I haven't included on the slide that I should is also we included drawing. So the students had the opportunity to actually draw certain parts of the face, and especially of a specific facial nerve. And they could use their own artistic license as well. It's an area that they were familiar with in terms of their previous anatomy knowledge, but they were never asked before to draw it on the spot in a historical setting. So it was quite interesting bringing all this together in a 2-hour workshop and engaging the learners in a very different approach and setting as well. And here you can see some of the historical books that were available. This is Vesalius Fabrica, the first book actually that combined anatomical illustrations with written text. So here you can see the actual object in the setting of the workshop. And this was one of the reasons why I wanted to go on site and deliver that teaching, because I wanted the students to have access to these physical resources, see the actual books, engage with them, and see, even, for example, here you can notice a little bit of water damage. That's quite important because it stimulates discussions of where did this come from, what does this mean, how did this happen, was this book actually used in the sala while they were doing dissections. And this is the original marble table, the dissecting table, and we can see the drawings of the students that they created, inspired by the anatomy that they had previously explored in the actual historical content and the actual historical setting they were placed. I'm very thankful, at this point I would like to say I'm very thankful to the academics who hosted me from the University of Copenhagen, and also for launching this unique module, but also to the Royal College of Medicine of Catalonia for allowing me to use the historical venue to deliver this workshop. So that's the first artifact, which is very much linked with illustrations and the art of storytelling. The second artifact is very different. It very much discusses poetry. And the second artifact has been actually a 1-hour online interactive poetry workshop, which I have been delivering since 2020 on an annual basis for the Masters in Applied Narrative Medicine at the Fondazione in Italy. So this Masters, in terms of a little bit of context, consists of 3 modules exploring important topics in the field of narrative medicine. They have roughly 30 to 40 students, and their students come from different caring professions around the world. The teaching languages include English and Italian, and my teaching was specifically in English. And this is one of the first slides that I actually use in my teaching, and I decided actually to include that as an image here because I think it's quite important to see the format of what happens in that workshop. So we see here, it's a very interactive workshop. First, we have the theory of poetry. And what does the theory of poetry mean within the context of a caring profession? Because that's what the learners want to see. How does it link with them so that they can develop that sense of familiarity and trust with me as their teacher? Then we have the dissection of poems in small groups and the poems, because I felt that poetry is more difficult compared to visual imagery, even storytelling in terms of science papers, because science papers are written in a certain way that everyone pretty much can understand them when they have a basic level of English language. But poetry is more challenging. Poetry doesn't only have the language component, it also has the hidden elements. So in this particular case, I wanted the poems to be translated in Italian as well. And this is some preparatory work we did. So the poems were translated from English to Italian. And the workshop was delivered in English, as I said. But if anyone had any queries, they could, of course, liaise with the other person that I was delivering the workshop with. And that person, that nominated person, could actually explain in Italian what a specific word meant, what the meaning is, and also if they couldn't understand anything in particular. That allowed for that language barrier to not to be a problem, basically, in the workshop. And then we had the analysis of the poems with a whole cohort. As I said, the first time I delivered this was actually while the pandemic was taking place, and the learners at that point, they had faced the raw reality of COVID, especially in the rural and north part of Italy. So I was very mindful to what poems I was going to select and how this was going to link with what they were doing, and maintain that fine balance of interconnections. So my aim was to empower them to discuss the patient perspective and voice, but also consider the universal interdependence that we humans have with our environment, but also the fine balance between humans and nature. And finally, I wanted to finish on a positive note because it was a difficult time. So I was thinking about human interconnections and hope. And very much this informed the selection of the resources I used. So it was the students' professional background, their experience at the time, and based on that, I thought the best way is to have 3 selected resources that can cater to these things that I wanted for the learners to discuss. So first of all, I started with William Blake's Auguries of Innocence, and specifically I selected 3 stanzas from this particular poem because it can be quite a long poem to dissect, and then John Donne's For Whom the Bell Tolls, but with a positive spin on that, which is that we are all, there is that universal interdependence and interconnection that brings us all together in terms of humanity, and Nuala Watt's The Eye Chart, which is a very interesting poem because it combines both the visual element, so the actual poem starts with big letters like an eye chart, and the letters become smaller as you progress further down in the stanzas. And also Nuala provides her own personal patient perspective into the equation. So as I mentioned, I did that during the pandemic. A lot of things have changed since then, and I have adapted the workshop. And something I did this year is I replaced William Blake's stanzas with original haikus. I wanted the actual participants to become active in the workshop even more, not just in terms of dissecting the poem, but creating their own poems as well. And I found that haikus was the best and easiest way to do that because they tend to be short and concise. And I use specifically a poppy blooms as an example for inspiration. And based on that, I explained what a haiku is, how many syllables to have per line. And then the participants were able actually to create their own haikus, which were quite interesting actually, and very good as well. So now that I have discussed the 2 artifacts, so one is more about mental or visual imagery, let's put it this way, anatomically related imagery and poetry in the context of anatomy. I think it's important to see how these 2 link. There is quite a lot of reflection that we can that can be had, especially in terms of the theories behind these 2 cases. So first of all, my artifacts are framed, as I mentioned, in object-based learning, but they're also grounded on the pedagogical paradigm of humanism. And humanism is actually the driving force behind all of this teaching. And I have chosen humanism because it places the students in the center of their learning journey. I'm the facilitator there, and I'm empowering the learners to drive the learning forward and link that with humanistic values. On the other hand, the object-based learning allows for active exploration, engaging different human senses. This is one of the reasons why I was so keen to go and teach in Barcelona, because I wanted the students to engage the tactile element, the sense of smell. How does that book smell? Why does it smell like that? Why does it have this particular feel? Where did this come from? So not just engaging the visual and the auditory elements, but everything else as well, because that allows for that active immersion and exploration of what they're doing. And I found that I was thinking when I was originally creating this learning, so how does object-based learning and humanism come together, and what's the point of it? And I was looking into the literature and I found this very interesting paper, and actually it has been argued before that combining object-based learning in the context of humanism can promote higher levels of cognitive interpretation, and we can actually take it to the next level of not just having this theoretical knowledge, but actually developing these links between that knowledge and the humanistic values, which is what humanism is bringing into that equation. So I was very keen to combine both elements. As I said, I use different resources. I thought it would be useful to have a slide on explaining what these resources were and what informed the choice of these resources, because they weren't just selected by myself. First of all, I wanted to have resources that they're both they can cater to physical on-campus settings, but also online environments. So in terms of physical, when we're talking about the first artifact, so the lecture and the workshop, we had the historical books, contemporary books as well, I should mention here. We had the DIY models. So we used affordable material to create anatomical models that engage different senses, but also the students through this were able to see how art can link with active learning and also with their own degree. And an area like the circle of Willis, which is the circulation to the brain, an area which is important clinically as well. And of course, drawings that engages the learners again in an active process of translating that knowledge, the theoretical knowledge that they have taken and they have learned, and they have also been examined, they have also been assessed in that, but actually interpreting that through their own art in their own way. And actually, something I should have mentioned, the drawings were created without prompts. So they had a specific area they could draw, but I didn't provide a reference image. It was up to them to come up with that information from memory. So I think that that was quite an important point as well, that influenced the dynamics of the workshop. In terms of online, for the first artifact, we had the mental imagery through the art of storytelling, which I feel was a good way of empowering learners to develop these thoughts and translate these thoughts and this knowledge they had into the next level of information. So the same way we did in terms of physical, and we have the books, the models, and the drawings. Here we have the art of storytelling, providing that means of creating that higher level knowledge. The visual information, which was the illustrations. And again, in terms of illustrations, something that I am thinking of how we can address in the future is the illustrations here are 2D representations of the original historical books or contemporary books and the rest. So in terms of online, the visual illustrations are not 100% a replicate of what we would do if we were to deliver that session on an on-campus setting. But as I said, I link that with a mental imagery, hoping that the storytelling would actually provide that additional element that was missing. And in terms of the second artifact, the second case study, poems was my resource. So I was quite happy with that in terms of delivering that online, but that can be delivered on campus with printouts of poems. So what informed the selection of these poems was again Prompt's theories, because I'm heavily influenced by him, I have to say, but also because the objects are also, they have, in his particular book, he has said that they're primary data carrying both physical and transient properties and information. And that is quite important because the objects are not just treated as objects, they're treated as objects with a lot of information, a lot of precious information. So in terms of physical properties, is the actual physical property of a book, the paper that the information has been printed on, the bound, how the actual volume has been bound, if it's leather bound, if it's spiral bound. So the actual physical properties of an object. The transient properties are the properties that are attached to the particular object as it has passed through the generations. So in the case of the historical book for the Fabrica, for the first artifact, for the workshop of the first artifact, we could see that there was some water damage, there was some staining. These are the transient properties attached to a particular object. And these actually stimulate discussions as to how were these transient properties attached? What do they mean? And they can stimulate quite a lot of discussion around the wider socioeconomic, political, and cultural changes that are happening in the wider society, not just anatomy. We can learn quite a lot from these objects, looking at what has happened to them. So I was very keen to take this information and translate it into the resources that were used for both artifacts. So what are the reflections? So in terms of delivery, as I said, on-campus delivery with physical resources allows for that, for the engagement of all different senses. On the other hand, online viewing through distant, online learning through distant viewing is quite important because anyone and everyone can join and can allow that. It can allow for this multidisciplinary interaction with people from all around the world who may have not been able to join otherwise. So there is this fine balance of delivering on campus versus online and how that can actually cater to the needs of each learner and each program's cohort. For me, it was very important to address the issue of accessibility. I wanted to promote accessibility by removing as many physical barriers as possible, including logistical and economical. So when I was thinking about my resource and my teaching, I took that very much into consideration. And the interaction, again, because it's central to object-based learning and humanism, I embedded online real-time audience response systems in both the on-campus and the online teaching that contributed to that knowledge exchange and that co-creation of the information. And in the case of the first artifact, it was through Mentimeter that the students informed and worked with me in partnership to create and inform the development of the workshop. So why is this important? It is important because research has actually shown that linking humanism, humanistic values, health humanities with basic science like anatomy, it can promote the development of clinical observation, diagnostic skills, humanistic values, reflection, and self-regulation of own emotions. So it can tackle on a range of different technical and professional attributes as well. In my particular case, it was important because I wanted to engage my learners in active and balanced discourse relating to challenging research topics or threshold concepts, while also maintaining that communication with them and that partnership with the aim of developing specific humanistic values, all of that centered in the context of anatomical sciences. And finally, explore different ADI topics in the context of historical and contemporary illustrations as the final part of the second workshop, which interestingly, it was actually the students who were interested in that, and they informed the development of that workshop through the Mentimeter. So to summarize everything, and what I have learned from this process as well as a practitioner myself is that the teaching resources are very much in the core of the wider socioeconomic, sociocultural, and political transformations that are taking place. And it is through these resources that we can discuss important elements that directly link with a specific program. Especially in the field of healthcare, not just for healthcare professionals, but also for science students who may be actually doing research that is related to healthcare, and for any caring profession as well. So that's the end of my talk. I'm sorry about the technical glitch at the beginning. I hope it was interesting. And I can actually stop sharing my screen as well, so you can see me.
Thank you, Orania. That was really interesting. Thank you so much. All right, so we're going to open the floor for questions. If you have any questions, any comments at all, I can make a start. So I think what if I put on my cognitive psychology goggles, right, then then the different activities that you're doing and how you engage the learner in different ways through different channels is dual coding, right? Dual coding elaboration, right? So it is basically engaging the learner about learning specific content, maybe abstract content as well, but breaking it down, making it more concrete in some ways, but also elaborate by engaging with the material in different ways. Would that be a valid, I don't know, summary in regards to cognitive processes, you think?
It is, and it's also the other way around. So piggybacking on a concrete subject or topic that they're familiar with and they're feeling comfortable with, and then from that going to the unfamiliar topic, which is the humanities and the humanistic values like empathy and compassion, because there are concepts that they're not as easy to grasp. So I always feel that human body, okay, anatomy, the heart, very easy to start with because people can relate, especially healthcare students from healthcare professions or science students. If I was to start the other way around, I have found it challenging to engage my learners and pull them in. So it was more the other way, but still. So in the lecture, in the first case, was first starting from a familiar topic, anatomy and art, first anatomy and then art. And then in the workshop, once they saw what I was trying to bring out from the session, they actually informed the development of the workshop, and it was more the other way around. So once we have established that rapport and that familiarity, you can easily see how they become more relaxed and more open to discussing topics that are slightly more unfamiliar.
Thank you. David.
Hi there. Thank you. Thank you for that talk. I was really interested in the use of the historical book in the work you're doing. And I was thinking you're talking about the water stains on it. And I know that having the physical book is actually part of the experience. But I was wondering if you thought about, if you've got books that are very delicate, that you wouldn't be able to use in other contexts, that you could use virtual reality to capture them and maybe actually capture the experience. And we've got, especially now at the University of Glasgow, we have lots of ways of being able to do that. The people in the Burns Centre, Burns being the poet, Burns, of course, have got this snuff box that you can actually that was owned by Burns that you can look at in using virtual reality and stuff like that. So there's quite a lot of possibilities of doing that. And I just wondered if you thought about doing that as well as, or how much you actually need the physical book in your hands.
So that's a brilliant question and a brilliant comment, David. And that's what I'm hoping to do my master's on, is actually taking these objects, digitizing them, but also creating 3D reproductions of them and seeing what the difference is and if there is a difference between the physical and the virtual. I'm very keen on, as I said, to stopping these barriers. Physical books are brilliant, but you rely on having access to these books. So I was very lucky when I went to Barcelona. The college had access to the books I needed. Sometimes I have to take my own books, which are quite vulnerable because they're fragile. Having access to them, actually feeling them, and exploring them can be challenging depending on how old they are, what they have been through. So your comment is exactly what I would like to do for my master. So if anyone is interested, I would be more than happy to collaborate. And that's what I'm hoping to do basically for next semester. Fingers crossed.
Thank you. Thank you, David. I have a question in regard to evaluation of your approaches. So obviously, always the most difficult thing is to show what kind of impact and effect any kind of, approach we take in psychology, in teaching have. Have you thought about any kind of ways you may be able to evaluate your approaches?
Absolutely. So something which I haven't mentioned because I haven't written it up yet is we got ethics approval and we collected feedback on not just my session, but generally how the humanism in medicine course, the impact that this particular elective had on that particular cohort of students. So we have that feedback, which is it's a mixed methods study using quantitative and qualitative information, and we're hoping to follow the learners forward and see what the impact is of the course in general, because what I discussed today is only one session of this course. So I felt that when I was thinking about delivering my teaching, I felt that just assessing my teaching is not enough. So I approached the three course coordinators and other people who taught in the course, and together we gathered that information. I am in the process of writing it. I have been in the past 3 months, but semester happened and teaching happened. So it's on my to-do list for this winter break. But the feedback is quite interesting, and it's interesting to see how the perceptions change of what the students were expecting to be taught compared to what they were taught and how they came out the other end. And in terms of actual impact, one of the students, and she has actually written a wee blog on that, and she presented that in international conferences. When I asked her to think as part of the lecture, think outside the box, what does art mean in the context of anatomy? And the word that she gave me was infinity, with the actual infinity symbol, and that was it. And then she explored and discussed that, and it's beautiful. The thoughts that have come out of that are absolutely beautiful. And what I'll do, I'll actually drop the link to the work she has published, because although it's one case study, I feel that you can see the impact of that particular question through Mentimeter. Think outside the box. What does this mean for you? So I will drop that here. In terms of sorry, I'm trying to multitask.
That's all right. That's okay. You can also send it to me. You can also send it to me later. That's okay.
Yes, my multitasking is not going very well just now. In terms of the second artifact, I haven't had the chance to actually liaise with the course coordinators and collect feedback, but it's something that, as a practitioner, you always reflect, but sometimes there's no time. So for me, it will be the next thing as well to see and see what the benefit has been as well.
Kenneth?
Yes, hello. My apologies. I can't say that I'm an expert in anatomy or art. My question, in a sense, or my understanding is there has always been, if we go back to Da Vinci's sketches of anatomy, there has been a strong connection between Renaissance art and the human form and discovering the anatomy of the human body. Is the same connection there with poetry? Is there a body of work that kind of is poetry? Does it have the same value as the visual sketches of someone like Da Vinci?
So thank you. That's a very interesting question, Kenneth. So thank you for bringing this up. So in terms of art, because anatomy is very much a visual subject, there has been a much stronger bond between the discipline of anatomy and anatomical illustrations and art in general. There is actually literature as well, because before Vesalius Fabrica, who combined art and text for the first time, everything was done in a narrative form. Galen's work is all entirely written in a narrative. There's no illustrations. And there's issues with that for a variety of reasons, but the actual narrative is very important. So there is narrative work that links with anatomy, is the narrative element. So the written narrative element hasn't become as popular compared to the illustrations. Some people there's different theories as to why this may have happened, and I have had some cases myself as well. The written element requires a certain level of literacy, which when the Fabrica was created, for example, that was targeted to a specific socioeconomic class, so it wasn't available to everyone, whereas the illustrations, everyone can see them and view them and appreciate them. It doesn't require that standard educational level. So that's one thing that, yeah, I feel it hasn't created a barrier, but it has, in a way, made the visual form more common and more prevalent. The other one is the poems. They tend to be scattered, and they tend to be, or the literature in general tends to be scattered from different people. In comparison, the art tends to be by the same person. And so, for example, you mentioned Da Vinci. We have associated his drawings with different elements. We don't have a specific anatomist associated with a specific literary work, like poems or long narratives, or even a book. We have a lot of medics, we have a lot of surgeons, but not necessarily somebody who's specifically focused on anatomy. We have a lot of neuroscientists who may have had originally a medical background, but again, it's not pure anatomy. And I think that's another thing to consider. But there is.
But
It's just not as common.
it seems to me that it would be slightly harder to do a poem on anatomy than it is to do a visual representation of something that, in a sense, you're seeing. And if there was a body of work that students could, poems in a sense that did that, then their poems, what they then produce becomes, building on that tradition.
Absolutely. One of the papers I mentioned in my presentation, they have actually done that. They asked their students as part of an elective to create different outputs, be it in the form of visual or written art, and of visual art or written narratives. And they also included drama as well in their elective. So I'm more than happy to drop that paper to you so you can have a wee look. There is, I'm not sure. I'm not sure if it's more difficult, maybe because I'm not an artistic person. I cannot draw for the life, but I can write poetry. So I'm a bit biased, I think, here. But I think it depends what also we empower our learners to do. So we each have different strengths and weaknesses. So if I have, let's say, my anatomy students or my medics or the dentist in the dissecting room, and if I ask them to either draw something or write a poem or write a short reflective narrative or a story, each of them will choose something different. And I think the written element hasn't been as popular as the visual element. And I think it just comes down to that. It would be a very interesting project to see.
I think if you use language, you have to use metaphor, you have to connect, you have to label things, you have to name things. And I think there's more abstraction in the written word than there might be in the visual drawings, because there is there's an accuracy in representation of something, whereas I don't know, as I say, I don't know enough about anatomy to actually start being poetic about it. So I think it would be, I would use probably engineering terms to talk about pumps and pipes and things like this. But you end up using language from another field to talk about.
But that again, yeah, absolutely. But that again is I don't see anything wrong with that. So it depends what you would like to do. Okay, it comes back to the visual representation showing anatomical fidelity compared to abstract art, for example. Okay, and also whether the poem is there to, or the short story is there to provide, and I see where you're coming from, to provide that anatomical fidelity. So what's the point of the two? So, and how do they link? It comes down to how skilled the person who is developing this is in terms of using language and can master the language. We had, there's a competition that was taking place, I think, 2019 or 2020. Is the usual competition takes place in St. Andrews. Is it Stanza? I can't remember the name. And actually a medical student from our university won that had written a poem about anatomy. And I will find that as well, and I will drop it in the link. I have a terrible memory.
That's what
so it comes down to, I think, it comes down to the skills that every person has and how well they can master them. But as I said, I'm very biased because I find poetry and creating and using even anatomical terms in poetry easier, but I cannot even draw a straight line.
All the links that you want to share, Ronja, you can just share it with me, because I'm going to put together a summary post and put it on the TIE website alongside with this recording, so you don't have to worry about it. Yeah.
Thank you very much.
No worries. Thank you, Kenneth, for the question. Are there any other questions for our speaker from today? If that's not the case, I would like again to thank you for joining us, for sharing your insights and your talk with us. Thank you so much. And I wish you all a good break, and see you in the new year. Bye.
Thank you very much. Thank you. Bye-bye, everyone.
Bye-bye.